Hello and welcome to this recording of the open enrollment presentation for the employees of AirSupply Jayco. We are looking at the benefits that start on July 1st, 2023. My name is Bill Hammett. I'm proud to be your insurance expert. My phone number and email address is on the screen. Should any of you have any questions throughout this period, whether it be open enrollment or whether you're a new hire starting anytime throughout the year, if you have questions on how to use your plan, what plan you should choose, what does any of these benefits mean? What's the difference between HMO and a PPO? All these things, we're here to help. Also available is Rhiannon and Anna. They can help with any questions you have now or throughout the year with claims issues, finding a doctor, getting a new ID card, understanding who to call for what. Reach out to any of us anytime. We'd be happy to help you throughout the year. Quick agenda, we'll talk about the timeline of open enrollment. We'll talk about medical, dental, vision, and life plans. We'll talk about how you enroll. And then, of course, if you have any questions, need any answers, you're welcome to reach out to us anytime. Open enrollment starts May 12th, goes through May 22nd. This is your time to enroll or waive benefits, add or waive dependents, move from one plan to the next. If you're on the HMO but want a PPO, you can do that now. If you were on a gold plan but want to buy down to a silver, this is your time to do that. You can make any changes you'd like, no questions asked. Once this open enrollment period is over, you'll be locked into that plan for the rest of the plan year, which goes through June 30th, 2024. Unless, of course, you have a qualifying event such as marriage, birth, adoption, divorce, if you're terminated, whatever it may be, then you can make plan changes. Any changes that you do make would go into effect July 1st, 2023. We're asking everybody to log in and complete all these, all the enrollment materials by Monday, May 22nd. And you'll do so in the online benefit portal that we call EASE. So let's talk about the medical plans available from Anthem Blue Cross. Same ones as last year, no changes here. We have 8 plans available. There's 4 HMO plans and 4 PPO plans. With our HMO plans, there's 2 silver plans and 2 gold plans. The company pays for 50% of the employee-only cost for the gold plan. That's why we call it the base plan. For those of you that prefer sharp doctors, you're going to want to go with these select HMO plans, very sharp heavy. For those of you that like Scripps doctors, you're going to want to go with these priority select plans. There's one of each, and one in gold and one silver. That's a Scripps heavy HMO plan. And then for those of you that value choice, that want to be able to navigate between multiple medical systems, you're going to need to go with the PPO plan. Lots of choice with PPO plans. But more cost out of your paycheck. So that's kind of the pros and cons there. So let's talk about these benefit plans. First, let's talk about our HMO plans. Notice up here, we got 1 silver plan and 1 gold plan, but really it's 2. There's the select HMO plan and the priority select HMO plan. There's a select gold plan and the priority select gold plan. Both of these silver plans have exactly the same benefits. The difference is going to be in, of course, the price. Very, very small difference there. But the biggest difference is going to be in the doctor network. Again, select HMO plans are going to have a sharp, heavy doctor network. So if you like sharp, you want to go with the select HMO. And for those of you that like Scripps, the priority select network is the Scripps heavy HMO network. So here's our 4 plans here, 2 silver, 2 gold. And our best value type plans, for those of you that don't need a lot of healthcare, that don't use your insurance very much, you're probably going to gravitate towards the silver HMO plans. There is a higher deductible, $2,500, out-of-pocket max of $9,100, co-pays for doctor visits, all that kind of stuff. So let's go through these benefits right here. I won't do this to you for every single plan, but I want you to be familiar with the terminology and get a little bit of a familiarity with how these benefit plans work. So up here we have a deductible. A deductible is what, generally speaking, the insurance company says you must pay all of this number before they start paying out anything. So you see with our silver plan, it's $2,500. Our gold plan, it's $0. So with our silver plan, you could be on the hook for the first $2,500 of expenses. As you can see with the gold plan, it's $0. Out-of-pocket maximum, this $9,100 number. This number, of course, includes this $2,500, so it's not $2,500 plus $9,100. The $9,100 is inclusive of the $2,500. So the 9,100 is the most you would pay no matter what happened. If you had $1 million hospital stay, if you're in the ICU for a month and it's $1 million, the most you're going to pay out of your pocket is $9,100. So that is going to be your maximum out of pocket. Now, a lot of people say, well, what's the difference between a deductible and out of pocket maximum? I don't understand. Well, think of it like this. A deductible, you pay 100% up to this number. After the deductible, you pay some of the cost, Anthem Blue Cross pays some of the cost, until you hit this $9,100 number, in which Anthem Blue Cross pays 100% and you pay zero for the rest of the calendar year. On January 1st, every single year, all these deductibles and out-of-pocket maximums all reset to zero. So even though our plan year goes from July 1 to June 30th, these numbers reset on you. So now there are some exceptions to this deductible, meaning there's times where you do not have to pay 100% of the cost. Those times are all indicated here wherever you see DED waived. So here we see office visits, $60 and $110 deductible waived. This means if I need to see a regular primary care doctor, I'm going to pay $60, deductible waived. If I need to see a specialist, I'm going to pay $110, deductible waived. And that means that that's my entire cost. I do not have to pay the first $2,500. I just pay the flat dollar copay. Primary doctor, $60, specialist, $110. For diagnostic lab and x-ray. So diagnostic lab, this is generally blood work, right? Where they're trying to take your blood work and look into what's going on and see if they can identify what might be ailing you. If you get this done in an office setting, you're going to pay $20 deductible waived. If you get it at a freestanding facility, meaning it's not a hospital, you're going to pay 0% deductible waived. So this is an office would be maybe inside of a doctor's office or in a freestanding facility, you would pay 0% deductible waived for lab work. X-rays, you're going to pay $20 deductible waived in a freestanding facility. Okay, so there's some differences between where you get it. What's most important for you to note is if you're getting either of these services in an outpatient hospital setting, you're going to have to pay 45% of the cost after deductible. So in this scenario here, in an outpatient hospital setting, you will have to have paid the first $2,500 and then you pay 45% of the cost. Okay. Now let's talk about imaging. So CAT scan, PET scan, MRIs. In an office or freestanding facility, you'll pay $200 deductible waived. Again, you do not need to meet your deductible before you get this benefit. If it's in a hospital setting, you're going to be paying after your deductible of $2,500, then you only pay $350. All right, so that can get a little confusing. And what I want you to remember is if you're in a scenario where you need blood work, x-rays, CAT scan, PET scan, MRI, whatever it may be, I recommend calling the member services number on the back of your ID card and asking them how you can access this benefit for the lowest cost out of your pocket. That's going to be your best bet there. Another line down, we have rehabilitation or habilitative therapy. This is physical therapy, occupational therapy, speech therapy, $60 copay, deductible waived. Chiropractic, $15 deductible waived, 30 visits per year. All right, let's skip all the way down here to urgent care at the bottom, $60 deductible waived. All right, so what this means with this silver plan, if I need to go to the doctor, a specialist, get lab work, x-rays, or MRI at a freestanding facility, or physical therapy, occupational therapy, speech therapy, chiro, or urgent care, all of those benefits I can get for a copay without having to meet my deductible. Okay, then, when does the deductible really come into play? Well, it comes into play anywhere you see the term after DED, after deductible. So usually this is in these big ticket items. So hospital stay, surgery, emergency room. All right. So you see 45% right here. A lot of people see this percentage and they freak out and they say, oh my goodness, what does that mean? If I have a $100,000 bill, I owe $45,000 of it? No. What this means is if you wind up in the hospital or you need surgery or you go to the emergency room, you're going to be asked to pay 100% of the cost for the first $2,500. Then you pay 45% of the cost. Blue Cross pays 55% of the cost. until you reach $9,100, at which point Blue Cross pays 100% of the entire cost and you pay nothing. All right. We skipped over top of this prescription drug benefit. Basically, it's got its own separate $200 deductible for an individual, $400 deductible for a family, and then you have copays throughout. Okay. There's two different levels of pharmacies. Level 1 pharmacies are cheaper than level 2. We'll get into that in a minute. And then, of course, there's different tiers of drugs. So we have generic drugs at tier 1. We have tier 2, which are preferred brand name drugs. Tier 3 are non-preferred brand name drugs. So these copays all apply after you meet this deductible. This deductible does not apply to our tier 1 drugs at all. All right. A couple more finer points here. You'll notice these numbers double for family, and you have the term embedded. If you are someone that's in a family unit, it's you and your spouse, your spouse and child or children. What this word embedded means is while there is a $5,000 family deductible, no one person in the family unit pays any more than their individual $2,500. All right, so if I'm on this plan, me, my wife, and 3 kids, and I have a car accident and I have $100,000 in bills, I will pay my deductible in full at $2,500, and then I pay 45% until I've hit $9,100, at which point I am covered 100% the rest of the year, and my kids and wife would have the other $2,500 deductible to meet cumulatively, and the other $9,100 to meet cumulatively. Okay, so the embedded term is good for you. It means that if one person in the family has a very expensive year, you're not stuck paying the whole family deductible and out of pocket. Another finer point to discuss is this deductible here. It's not a per incident deductible like car insurance is. If you get in an accident in February and have a $1,000 deductible, you pay the full $1,000 on your car insurance deductible. And then let's say in July you get in an accident again, you pay your deductible, your car insurance deductible of $1,000 again. Okay, that's a per incident deductible. Car insurance does it that way. Health insurance does it a little different. It's an annual deductible, meaning if you were to get an x-ray or lab or an MRI at an outpatient facility and you were asked to pay 100% of the cost, and let's say it was $500 for an MRI at an outpatient facility, you would pay all $500, but now you only have $2,000 left of that deductible. So if you did have that $100,000 problem, remember, you already paid $500 towards your deductible for that MRI, and now you've got that $100,000 hospital stay. You would pay 100% of the cost for the first $2,000. That's what's left of your deductible, and then you'd pay 45%. Okay, so that's how that would work. Now, let's say you've met your deductible in full because you've had a few MRIs, or you had an emergency room visit, or maybe whatever it may be. Then you go get that MRI and it's just $350. Okay, so it's not every time you have to use your plan, you have to pay your deductible in full. It's a cumulative running number for your deductible over the year. Let's look at this Gold HMO. The Gold HMO plans, again, there's 2 of them here, the Select and Priority Select. Select meaning sharp, Priority Select meaning scripts. No deductible. Our maximum out of pocket is much lower. Our copays are much lower across the board. There's no brand name drug deductible. Our copays are lower here. But check out how hospital services, surgery, and emergency room are covered. Instead of a percentage, you would pay a $600 a day copay for 4 days. Meaning if you're in there for a week, you pay $600 for day 1, 2, 3, 4. And after day 4, you no longer pay that copay any longer of the same stay. All right, it's not that they throw you out of the hospital after 4 days. It's just that you stop paying that copay. Surgeries are a $450 copay. Emergency room visits are a $325 copay. This is very important to understand in how you are selecting your plan. How do you use your plan? Do you go to the emergency room a lot? Do you have kids in sports and they're breaking collarbones? Do you go snowboarding? Do you need a surgery coming up? Are you having a baby and you know you're going to be in the hospital? If you know of some of these more expensive services you're going to need, I recommend very strongly that you go with one of these Gold HMO plans, because while yes, it will cost you another $10, $15, $20 a paycheck out of your paycheck, it is going to save you thousands of dollars when you need to use the plan. Okay, so you can understand if you're having a baby on this silver plan, you're going to pay 100% of this first $2,500, then 45% up to $9,100. Having a baby, having a C-section and a baby is going to cost you basically $9,000 with these silver plans. Whereas if you choose a gold plan, it'll cost you, $600 for 2 days plus the surgery. So you're at $1,200 plus $450, $1,650. Okay, so again, thousands of dollars less. All right, so for those of you that know you have medical expenses, that know you're going to be using your health plan, I love this gold plan. For those of you that have a health plan just because you need one in case you get sick, maybe you just need a couple of generic drugs, maybe you just need to go see a doctor once or twice a year, these silver plans are going to be great for you. So let's talk about our PPO plans. We have a bronze and a silver. So this bronze PPO plan is going to be super attractive because it's very low cost, but buyer beware. Remember how we talked about deductibles on that previous page? This deductible is $7,300. All right. You do get some benefits like doctor visits deductible waived, x-ray, lab work, deductible waived, physical therapy, occupational therapy, speech therapy, deductible waived, chiro, urgent care. You're getting these benefits deductible waived, but if you do end up in the hospital, if you do need some of these big ticket items, you're going to be paying the first $7,300 out of your pocket, 100% out of your pocket before Anthem Blue Cross jumps in and pays any portion of it. So the bronze plan is very attractive because of the premium, but be very careful because the deductible is high. And if you have a very expensive event, you're paying the whole thing. A silver plan, very good value for a PPO plan. If you're someone that needs the PPO plan but doesn't want to spend a ton of money, our silver PPO plan is pretty good. We've got lower copays. The deductible is at a more tolerable rate, just under $2,000. Our prescription drug benefits are better. Our urgent care visit benefit is better. But again, if you need to be in the hospital, you're going to pay the first $1,950 plus 35, then 35%. Until you hit $9,100 out of pocket. Our gold and platinum plans, these are the rock star plans, very, very good stuff. The gold PPO plan, low deductible at $500, out of pocket max is still pretty high, close to $8,000. But here are copays, no brand name drug deductible, lower copays across the board. So our gold plan is very good. And then you got the diamond level, platinum PPO plan, low deductible. And the biggest difference here with these platinum plans versus gold, silver, any of them, is the maximum out of pocket. So for those of you that might have a ton of out of pocket expenses, might have all kinds of things going on, with this platinum PPO plan, it will be the most expensive plan available, but your expenses are capped at $3,800 on the year. So you see how the difference between the gold and the platinum plan is $4,100 in out of pocket expenses. That's pushing $400 a month in premium. So if I'm looking at these plans and I know I want a PPO plan, and I look at the platinum plan and it costs me $250 more a month than the gold plan, but I know I'm going to use the crap out of it, I like the platinum plan better because over the course of the year, the $250 a month in premium, which by the way is tax-free because you're coming out of your check pre-tax, that equals $3,000 of premium to save $4,100 in out-of-pocket maximum. All right. It's kind of confusing. It's a lot to say right there. It's a lot to take in. So if you're listening to this and you're one of those people that needs a lot of choice of the PPO plan and you know you have a lot of expenses, please remember to reach out to me. My name is Bill Hammett. You can get my information from Sean, from Laura, from the second page of this presentation and the last page of this presentation, and let's talk it through. So those are your PPO plans. We talked about the different levels of pharmacies with those prescription drug benefits. You saw it here, level 1, level 2. Anthem Blue Cross has their RX Choice tiered network. Level 1 pharmacies are basically CVS, Target, Walmart, Costco. Level 2, you're going to be into the Walgreens and Rite Aids. Okay, not a comprehensive list of both of these networks, but it does give you a really good idea of where you should be trying to go. For the full list, you would go to anthem.com/CA, choose order and manage prescriptions, go to the pharmacy page and choose find a pharmacy. Okay, this is where you can find that information. Here's a quick plug to make sure that you download the Sydney mobile app and log into the Anthem portal and register. Being able to do these two things will help you self-service yourself, will help you look up your claims, will help you find doctors, find prescription drugs, understand how to find the cheapest MRI or lab work. The number one thing you can do to improve your benefits experience is to log in, register on the desktop app, and then also have the Sydney mobile app for yourself. A couple extra added value type benefits for those of you that want to connect with a doctor anytime, anywhere. Virtual visits are available through the Sydney Health app, so you can log in here. Again, download the Sydney app, and you can do a lot of cool stuff with it. Also through Sydney Health, connect with virtual support for a lot of things, including mental health support from home. There's an employee assistance program also available, and you can get counseling, legal consultation, financial consultations, ID recovery, dependent care, and daily living resources, all these things, all through the employee assistance program here. So let's talk about our HMO dental plan. So that's all our medical stuff. We're going to talk about dental. We've got one HMO dental plan. HMO dental plans are great because they don't cost very much. You get a couple free cleanings, but the drawback is they don't have a lot of dentists in the network. So it's nowhere near as large as the PPO dental networks. HMO dental plans are great for those of you that want just a couple free cleanings and you're not that picky on who you go see. Here is our HMO dental plan there through Humana. They use the Liberty Dental Plan. So if you're trying to find a dentist, you'll have a link to this exact site in the enrollment portal. But once you get there, you're going to hit the DHMO button, Dental HMO, and then select the Liberty Dental Network. Our PPO dental plan, also through Humana, there's a $2,000 annual maximum. It covers 100% of preventative services, 80% of basic services, and it's a 50-50 split on all major services. Now, the one thing to note about annual maximums with dental is it's exactly the opposite that we talked about with medical. Remember, with medical, we said once you hit the max, you pay nothing else, and they pay everything. With dental, it's the exact opposite. Once you, as a member, have spent $2,000 of Humana's money, they no longer pay anything and you pay 100%. All right, so that's a very important note. Humana does have an extended annual maximum, which we'll talk about in just a second. Another little nugget for you: if you're just signing up for the first time right now in July, or maybe throughout the year, these annual maximums are calendar year annual maximums. This means that if you sign up July 1st, 2023 for a PPO plan, you have $2,000 to spend between July and December 31st. And then on January 1st of 2024, you're going to get a fresh $2,000 to spend, and you can spend that all the way till July of 2024, at which time maybe you've gotten all your work done and you can cancel this policy. So for those of you that have a lot of work that you need to get done and you want to use it in that fashion, the PPO plan becomes a really great value because you can get $4,000 worth of benefits for the price of 12 months of premium. So if you want more information on that, or if you want to hear that again, reach out to me. I'm happy to help. So our additional extended annual max covers after you've exceeded your annual maximum. There is additional coverage for preventative, basic, and major services after the calendar year maximum met at 30%. All right. So that's your PPO dental plan. Let's talk about our one vision plan for those of you that need vision plans. We've got our Humana Vision Plan for your annual exam. It's a $0 copay. If you need contact lenses, it's $0 for the fit and the follow-up. And you can see some of these contact lenses down here. You have a $200 allowance for that. And that allowance is the same thing for frames or contact lenses, okay? So you have a $200 allowance, meaning if you want to go find a set of frames that are $200, you'll apply this credit to this, or this allowance to it, and you'll pay nothing. If you want some fancy Prada, Gucci, Chanel frames, then they're $500, then knock yourself out. Humana will pay 200 of it, and you pay the other 300. A little bit more information on the vision care services. That frame benefit is once every 24 months. The other ones are once every 12 months. This document is located in the enrollment portal for your review should you want it. So let's talk about our enrollment portal, which I'm going to actually do a quick run through here in just a second, but this is the landing page, what it looks like. So you'll look for that. We're going to do that in just a second. So for those of you that are familiar with the enrollment portal, you don't need to stick around. For those of you who are not familiar with it, stick around for just a second. We're going to do a walkthrough of it. So next step, look for an email from the Ease Invitation login. Your deadline is Monday, May 22nd. If you have any questions, you need any answers, reach out to me or my staff and we'd be happy to help. So for those of you signing off, thank you for your attention. And for those that would like to stick around for a quick tutorial of the enrollment portal, please stick around. We'll start that right now. So here's our enrollment portal. Looks just like this. You'll log in and take me to the admin page because I'm both. I'm going to switch. This is what you'll see. You're going to land here. It's going to say start enrollment. You want to hit that. Give you an idea of what to expect. Boom. This video you're watching is going to be embedded right there. Continue. Put all your information. Continue. Add your kids, your spouse, whatever. Adding them here does not add them to any policy. It just gives you the ability to toggle between what it costs. If you're on Medicare, you'll enter that information here. If not, you'll continue. Then you get to your benefits here. So I'm enrolling my kid and myself in this. Watch what happens to these numbers right here once I decline. They change instantly. Why aren't you changing? If we change to another plan, it changes instantly. You'll see how these numbers change right away. As soon as I decide not to enroll my child, these numbers change right away. Okay, so you see all the different plans that are available. You see that underneath all of them, there's a benefit summary that you can open up and review. You can download this, you can print it, whatever you want to do. It gives you a lot of information on the plan that you're choosing. You can click here to be taken to the Anthem Blue Cross site to find a provider. For those of you that are not enrolled yet and you want to find care, you can do that here. Just wait for it. If you can log in, do that here. If you want to use your ID for a search, you can do that here. But for many of you, you'll just sign as a basic search as a guest there. You can download the mobile app flyer there. You can download a document to help you print a member ID card. And then the summary of benefits and coverages. This is a document that's mandatory that you open. If you neglect to open it, you'll be asked later on in the process to come back and open it. Let's go ahead and I'll choose a different plan so you can see what that looks like if I forget to do that. If I choose an HMO plan at the bottom, it's going to ask me to choose a primary care provider. I can log into the Anthem Blue Cross site right here and find a primary care provider, or I can just ask them to auto assign a provider. Doing so means that they'll just give me one that is near my home. You can change your provider anytime. You can do that the first of any month. Let's enroll in dental. Let's wait for my kid. I can say I don't want it. Choose to be without insurance. Explain. Do not want. Okay. I'm going to choose the PPO plan. If I were to choose the HMO plan, it's going to ask me for a primary care provider. If I choose the PPO plan, it does not. Again, you have links to different benefit summaries and finding a dentist here. Vision. We'll enroll both of us there for the one vision plan. Continue. There's also a $15,000 life insurance policy that's paid for 100% by your employer, which is great. Continue. It's going to ask for my beneficiaries now because I haven't done that before. I can add more beneficiaries. Here's my summary of all the different enrollments I have. Continue. Now, this is what I was talking about. I never opened that summary of benefits and coverages, so it won't let me sign yet because it's mandatory I open that. Why is it mandatory? Because Obamacare says your employer must show you this information, so we make this mandatory. You'll click on it, you'll open it. You don't even have to wait for it to open, and you can get back to the screen. Continue. You'll sign forms. And for those of you that have used DocuSign in the past, it's the same exact idea here. We're gonna type our name. We're going to use our mouse, or if you're using a mobile device, you're going to use your finger on the screen. And then you just go through the whole application and just click on all the green boxes. It'll insert your application. You'll hit finish signing, and then you'll say all done. And that is the end of what you need to do there. You'll get an email that says thank you for completing your enrollment elections. They've been submitted, and then you're all done. So thank you so much for your time. I appreciate your attention. And if you need me for anything, please reach out. We'd be happy to help.